Hello and a very warm welcome to all enthusiastic learners joining us today. Today we are going to further explore types of bioelectrodes and we will introduce electrocardiogram ECG. Before moving ahead, let us take a quick recap of what we have covered in our previous lecture. In our previous session, we started with polarization. In that, I explained the phenomena of polarization in electrode and its impact on biopotential measurement. Understand the factors contributing to electrode polarization and how it affects the signal accuracy. Then we differentiated between polarizable and non-polarizable electrodes based on their behavior during measurement. Then I have covered the motion artifacts in biopotential measurements, identifying common sources of motion artifacts in biopotential recording, discuss the strategies and techniques to minimize the impact of motion artifacts on signal quality. Then we have identified the equivalent circuit for biopotential electrodes. In this, we introduce the equivalent circuit model for biopotential electrodes and its component. Understand how the equivalent circuit aids in analyzing electrodes behavior and signal characteristics. Then we explored the types of biopotential electrodes. In this, we introduced three main types of biopotential electrodes, namely surface electrodes, microelectrodes and the needle electrodes. I hope you are all excited to dive into a fascinating topic today, the different types of surface electrode. We have already explored what surface electrode is and explored that how this electrodes plays a pivotal role in capturing bioelectrical signals and the unique attributes they bring to the field of biomedical engineering. Unveiling the surface electrode. Surface electrodes are crucial part of bioelectrical signal measurement. They allow us to tap into the body bioelectrical activity without the need for invasive procedure. Today, we are diving into the various subcategories of surface electrodes, each with its own set of design consideration, applications, advantages and limitations. We already embarked on this journey by discussing two of these subcategories, a metal plate electrode and the suction cup electrodes. Now, let us take a step back and introduce in a brief manner the concepts of surface electrode, why they are so essential in our field, capturing the biosignals non-invasively. Imagine the incredible possibilities that arises when we gathered vital information about the body's physiological process without the need of surgical incisions. Surface electrode make this possible by safely and non-invasively capturing the electrical signal generated by the body cells, muscles and nerves. Whether it is monitoring cardiac activity through electrocardiograph ECG, taking muscles contractions with electromyograph EMG or mapping brain wave using electroencephalogram EEG. Surface electrodes open doors to a world of insight that were once out of the reach without invasive methods. Uniqueness of surface electrodes is that the surface electrode has the ability to establish a connection with the body surface without going through an invasive technique. Today, we will be focusing on the metal plate electrode, suction cup electrode, adhesive tape electrode, multipoint electrode and floating electrodes. Each of this category brings its own advantages and considerations By understanding their individual characteristics, we can choose the right tool for the right job, ensuring accurate measurement and valuable data collection. In surface electrode, we have already covered the surface electrode and their importance in biomedical signal measurement. In metal plate electrode, we have delved deeper into the metal plate electrode and identified how they stabilize a reliable connection for signal capturing. In suction cup electrodes, we also explored the unique concepts of suction cup electrodes and how they ensure stable attachment during measurement. Now, we uncover the nuances of two subcategories of surface electrode. So, without failure, let us dive into the remaining categories of surface electrode and continue our journey of exploring the remaining subcategories of surface electrodes, such as adhesive tape electrode, multi-point electrode and floating electrodes. These electrodes empower us to unlock the secrets of human body bioelectrical activities. After completing this surface electrode, we also explore the microelectrodes and needle electrodes in today's session, explaining the design, material, specific applications of all above types of biomedical electrodes and showcase the real world applications of this biopotential electrodes in medical diagnostics and research. Further, we will also explore the topic electrocardiograph, abbreviated as ECG, the electrical signals generated by heart, which will be also covered in today's session. We are diving into the fascinating worlds of electrocardiograph, or we commonly call it as ECG. In this session, we will unveil the electrical signals generated by heart and learn how this technology help us to gain profound insights into the cardiac health. The human health, a remarkable organ that beats tirelessly to sustain our living, isn't just a mechanical pump. It's also a highly coordinated electrical systems that orchestra the rhythmic concentration we feels as our pulse. The symphony of electrical impulses fuels our heartbeat, and ECG is the technology that allow us to listen it. Dear all enthusiastic learners, in today's session we will cover the remaining of part types of the biopotential electrodes and introduce the topic electrocardiogram, also called as ECG or EKG. Now, let us move ahead with the surface electrode third category, that is the adhesive tape electrode. First of all, let us have an introduction of adhesive tape electrodes. These are specialized types of surface electrodes commonly used in biomedical engineering to capture bioelectrical signals from the skin surface. These electrodes are designed with adhesive backing to ensure secure attachment to the skin, facilitating comfortable and consistent measurement. If we consider the designing constructions, adhesive tape electrodes consist of following components: a flexible and thin adhesive backing made from hydroallergic material to prevent skin irritations, a conductive electrode element often made of silver, silver chloride or other conducting metals embedded within the adhesive, lead wire or connectors for signal transmissions from electrode to the measuring equipment. Now, how these electrodes are placed and what are the preparation required? The skin area intended for electrode placement is cleaned and dried to remove oil and debris. The adhesive tape electrode is applied directly to the skin over the desired measurement site, creating a secure connection. For certain application, a conductive gel may be applied between the electrode and the skin to ensure electrical contact. If we talk of the applications, adhesive tape electrodes are widely used in various bioelectrical signal measurements such as electrocardiogram, electromyogram, electroencephalogram. They are suitable for both short term diagnostic, recording and long term monitoring situations. The advantages of this adhesive tape electrodes are easy applications, as the electrodes are user friendly and can be quickly applied to the skin, saving the time during preparation. The next advantage is comfortability. The patient finds them comfortable due to their thin and flexible design. The next advantage is secure attachment. The adhesive backing ensure stable electrode placement, minimizing the risk of movement artifacts. Minimum discomfort. The use of the non-allergic material reduces the likelihood of skin irritations. There are some disadvantages also which are associated with these types of electrode. They are adhesive sensitivity. Some individual might have skin sensitivity or allergy to adhesive material. Limited usability. Adhesive tape electrodes may lose their adhesive property after a single use and required replacement. Residues. Adhesive residues can remain on the skin after electrode removes, require gentle cleaning. The precautions associated with such types of electrode are skin sensitivity. Prior to the applications, it is important to ensure the patient does have or not some allergic or sensitivity to adhesive material. Site selection. Careful consideration should be given to the placement site to avoid areas with excessive hair or skin folds that might affect the adhesive and adherence. Monitoring skin health. Regular checkup should be conducted to assess the skin condition under the adhesive to prevent irritations or damage. Adhesive tape electrodes offer a practical and versatile solution for captivating biosignals and make them popular choice in clinical and research setting. Their ease of use, comfort and reliable attachment to the skin contributes to their widespread applications in diverse bioelectrical measurement. Now, we come to the next subcategory of electrode, that is the surface electrode, which is known as the multi-point electrode. The multi-point electrodes are specialized types of surface electrode used in biomedical engineering to captivate bioelectrical signals from multiple points on the body surfaces simultaneously. These electrodes are designed to provide spatial information and comprehensive view of underlying bioelectrical activities. If we talk of the design and the construction, multi-point electrodes consist of the following component. Multi-point electrodes elements are arranged in an array or grid pattern. Each electrode element is typically made of conductive material such as silver chloride and is embedded within a flexible substrate. Lead wire or connectors for each electrode element, enabling the transmission to the measuring equipment. Now, if we talk of the electrode placement and preparation, the screen area for electrode placement is cleaned and dried to ensure optimal electrical contact. Multi-point electrodes is positioned on the skin with its array of electrode element placed over the desired measurement area. Adequate spacing and positioning of electrodes elements are crucial to capture the actual spatial information. If we talk of the applications, multi-point electrodes are used in applications where spatial distributions of bioelectrical signal is of interest, such as mapping muscles activities or studying brain functions. They find use in electromyography to analyze muscles activity and in electroencephalography to map brain activity. The advantages of these electrodes are spatial resolutions. Multi-point electrodes provide high spatial resolutions, allowing for detailed mapping of bioelectrical signals, comprehensive insights. The array configuration captures data from multi-point, offering a comprehensive view of complex biosignals processing. Efficiency. Simultaneously measurement of multi-points reduces the need of repositioning the electrodes, saving time during data collections. There are some disadvantages also. The first disadvantage is the complexity. The designs and setup of multi-point electrodes can be more complex as compared to single point electrodes. Signal crosstalk. Close proximity of electrode element may lead to signal interferences or crosstalk if not properly managed. Data handling. Capturing and analyzing data from multi-point electrode elements may require specialized equipment and software. There are some precautions. Electrode placement and accuracy. Precise placement of array over the target measurement area is crucial for obtaining the accurate spatial data. Signal interferences. Measurement should be taken to minimize signal interferences between adjacent electrode element. Data validations. Signal quality from each electrode element should be verified during data acquisitions to ensure meaningful results. Multi-point electrodes offer a valuable tool for researchers and clinical seeking details, insights into spatial biological activities. Their ability to capture simultaneous data from multi-point enhances our understanding of complex physiological process and contributes to the advancement in the area such as muscles functions analysis, brain mapping and sports sciences. The next subcategory of this surface electrode is the floating electrode. Floating electrodes are the subclassifications of surface electrode commonly used in the field of biomedical engineering, which aligns with your expertise. This electrodes plays a significant role in various applications, particularly in context of signal measurement and acquisitions. Let us look into different aspects of the floating electrode based on the following points. First, we will conclude the introduction part. The floating electrodes are special surface electrodes used for recording bioelectrical signals or measuring voltage potentials without being directly connected to the reference ground. Unlike traditional surface electrodes, which are typically connected to ground or reference point, floating point electrodes are isolated from any direct electrical connections. These isolations help to minimize the impact of interferences, noise, making them particularly useful in the situation where accurate and clean signal measurements are crucial. If we talk of the designing and construction, the designing of floating electrodes involve using high impedance material and component to maintain isolations from ground. These electrodes are usually constructed using materials with low leakage current to prevent unwanted electrical path. The design may include shieldings to further reduce the interferences from external electromagnetic field. The electrodes are often made up of biocompatible material, especially when used in medical or physiological applications. If we talk of the electrode placement and preparation, the placement of floating electrodes depend on specific applications. They are commonly placed on the skin surface for recording bioelectrical signals like electrocardiogram, electroencephalogram. Proper skin preparations is crucial to ensure good conductivity and minimizing the impedance between the electrodes and the skin. This often involves cleaning the skin and applying conductive gel to improve the electrode skin contact. Applications and advantages: reducing the ground noise. Floating point electrodes are particularly useful in the environment where ground noise or the interferences can affect signal quality. Since they are isolated from direct ground connections, they are less susceptible to common mode interferences. High quality signal acquisition. The isolation provided by the floating electrodes allows for accurate measurements of small bioelectrical signals, making them ideal for the applications such as medical diagnostics, neurophysiological studies. Then the next advantage is flexibility in signal acquisitions. Floating point electrodes can position more flexibly on body, which is advantageous when dealing with irregular shaped surfaces or specific measurement required. There are some disadvantages also. Isolation challenge. While isolation is beneficial, it can also lead to a built up of charge of electrode surface, potentially causing artifacts or signal distortion. The next one is signal drift. Floating electrodes might experience signal drift over time due to the absence of stable reference point. There are some precautions while using these electrodes. The first one is discharge. To avoid charge built up, it is important to periodically discharge the electrode and ensure that any accumulated charge is dissipated. Signal conditioning. Employ signal conditioning techniques such as using a differential amplifier to further enhance the quality of acquired signal and mitigate potential signal distortions. Electrode impedance. Keeping a check on electrode impedance to maintain the proper electrode skin contact and minimizing signal loss. In summary, you might find floating electrodes useful due to their relevance in signal acquisition and measurement techniques. They offer advantages in terms of noise reductions, accurate signal acquisitions, while also required careful considerations of isolations and charge related challenges. Now, let us come to the next category of electrode, that is the micro electrodes. These are specialized types of electrode used in various fields including the biomedical engineering. They are characterized by their small size, enabling precise measurement of electrical potentials at localized point. Microelectrode plays a crucial role in applications ranging from medical diagnostics to material characterizations and research. If we talk of the designing and the constructions, microelectrode are designed to be extremely small, typically on the micron scale. They can be further classified into two categories: metallic electrode and non-metallic electrodes. Metallic electrodes, these electrodes are typically made from metal material like platinum, gold or tungsten. Their construction involve intrinsic fabrication techniques such as micro machining. The electrode tips shape can vary, such as conical or cylindrical, to suit specific applications. Now, let us take the non-metallic microelectrodes. These electrodes are constructed from non-metallic materials such as glass, semiconductor materials or polymer. They offer specialized coating to enhance the electrical property or increase biocompatibility of medical applications. If we talk of the electrode placement and preparation, the placement of microelectrodes depends on the applications. They can be used for intracellular recording and extracellular recordings. For proper electrode preparation involve ensuring high quality electrode material, interfacing, which might require surface treatment or coating to enhance conductivity or biocompatibility. If we talk of the applications and the advantages, it has high spatial resolutions. Microelectrode offers exceptional and spatial resolutions due to their small size, precision measurement. These electrodes are capable of detecting minute changes in electrical potentials, minimal tissue disruption. In medical applications, microelectrodes can be useful for minimally invasive procedures. There are some disadvantages also. Challenges associated with fabrications. Manufacturing of microelectrodes involve complex and sometimes expensive fabrication techniques. The second disadvantage is associated with signal to noise ratio. Smaller electrode might have a lower signal to noise ratio compared to a larger electrode. There are some precautions. The first is calibration. Microelectrode should be carefully calibrated to ensure accurate measurement. Electrode stability. Maintaining stable electrode performance over time by considering the factors such as electrode fouling, which can affect the measurement. Biocompatibility. For medical applications, ensure that the electrode materials are biocompatible to minimize tissue reactions or adverse effect. Thus, in realm of biomedical engineering, Microelectrodes may be of interest due to their relevance in various sensing, measurement and signal acquisitions technology. Understanding their design, constructions and applications could provide a valuable insights into the development of advanced microelectronic devices and systems. Now, we talk of the depth or the needle electrodes. The depth of the needle electrodes are specialized electrodes used for precision and targeted measurement of electrical activities within the tissues, particularly in medical and physiological context. These electrodes are designed to penetrate the tissue, allowing for the recording of deeper layer and structures such as muscles or organ. They play a crucial role in applications like electrocardiogram, deep brain stimulations. If we talk of the designing and the constructions, deep or depth electrodes are typically thin, elongated probes with a needle-like design. They are constructed from the materials that offers both electrical conductivity and mechanical strength, such as stainless steel or tungsten. The distal end of electrode, which make contact with the tissue, might have various tip configurations, including pointed, ball-shaped or even multiple electrodes contact along the length. If we talk of the electrode placement and preparation, placement of depth electrode required precision to ensure accurate measurement and minimal tissue damage. Depending on the applications, the electrode might be inserted directly into the tissues using surgical procedures. Proper electrode preparations involve sterilizations and ensuring that the electrode tip is clean and free from debris to ensure reliable electrical contact. If we talk of the applications and the advantages and the applications are targeted measurement. Depth electrode allows for localized measurement of electrical activities, providing insights into the specific tissues or region of interest. Now, if we talk of the disadvantages, these are invasive in nature. Depth electrode required insertions into the tissues make them invasive compared to surface electrode. This can lead to tissue damage or infection risk. There are some precautions that need to be taken care. The first is the surgical expertise. Proper insertion of depth electrodes requires surgical expertise to minimize tissue damage and complications. Sterilizations, maintaining sterilized condition during electrode insertion is crucial to prevent infections. In the context of biomedical engineering, understanding depth electrode could be valuable for applications involving medical instrumentations, signal recording or bioelectrical signal processing. These electrodes showcase the intersections of electronics and medical technologies, contributing to the advancement in diagnostics and many other clinical procedures. Now, with this we covered the topic titled types of electrode. Now, let us move into the next topic, that is the electrocardiogram. We abbreviated it as ECG. The heart is the main organ of cardiovascular system, a network of blood vessels that pumps blood throughout the body. It works with other body systems to control heart rate and blood pressure. The main function of this heart is to move the blood throughout the body. It's also control the rhythmic and the speed of heart rate, maintaining the blood pressure. Our heart is very important organ, and that's because it contract and generate the hydrostatic pressure that is needed to move all the blood through the blood vessels of our cardiovascular system. Now, the question is that what exactly causes the muscles of the heart to actually contract in the first place? This is what we are going to focus. So, it turns out that the heart itself is actually capable of generating the electrical signals, and as this electrical signals moves within the chamber of the heart, it causes those chamber to actually contract, so that the electrical signals that move to the heart, that causes the heart to contract as a whole and pumps all the bloods through the blood vessels of our body. The automatic nervous system is capable of regulating the rate at which the heart contracts, but even though the automatic nerve systems regulate the beats of the heart, it does not initiate the beats. our cardiac muscle cells are actually capable of generating those electrical signals without the input of the nervous system. So, let us begin by taking a look at the cross sections of the heart as shown in this diagram. So, we have the right side of the heart, we have the left side of the heart, along with it we have the superior and the inferior vena cava, the right atrium, the right ventricular, the left atrium and the left ventricular. We have the pulmonary arteries that is extended into the lungs. We have a order that split into the ascending and descending aorta. Now, let us take a closer look into the right atrium of the heart. The right atrium and the upper wall of the right atrium of heart containing a small bundle of specialized cell that together are known as sinoatrial nodes or simply SA nodes. It is the cell within the SA nodes that responsible for initiating the action potential by depolarization. So, as the cell depolarize within SA nodes, they generate a impulse and action potential that moves within the arterial of our heart, and it moves within the two arterioles of the heart. It causes those arterial to actually contract. So, the sinoatrial node basically initiate its own action potential without the input of automatic nervous system, and that is exactly why the SA node is commonly referred to as the natural pacemaker of the heart. It generates an action potential in the right atrium, which then moves into the left atrium and eventually into our two ventriculum. So, it triggered a set of electrical events within the heart that causes the heart to actually contract and pump all the blood through the blood vessels of our body. Now, the rate at which the SA actually contract varies from 60 to 100 beats every single minutes, and this is actually pretty high. So, what the nervous system does is it uses the vagus nerves to actually decrease the rate at which the heart actually contracts. We will see what that means and how that works in just a moment. So, once again, the SA node is the sinoatrial nodes. It is a collection of specialized cardiac muscles cell found in the upper portion of the right atrium that generates action potential and impulses, and then the impulses move with specialized conductive channels through the right atrium and the left atrium, and at the same time it causes these two atriums to actually contract. Now, what exactly happens when we have sinoatrial nodes? We have another types of nodes known as AV nodes, which stands for the arterial ventricular nodes. Now, the arterioventricular nodes is also a collection of specialized cardiac muscle cells that located inside the inner arterial spectrum of our heart, basically the wall separating the two arterial of the heart. So, this is found between the arterial and between the ventricle of our heart. Now, what this AV node does? It does two things. Firstly, once it actually received that action potential from SA nodes, it delay that action potential by about 0.1 of a second, and the reason is creating the delay in electrical signal is because it wants to make sure that the two arterial finish contracting and finish moving all the bloods into our ventricle of heart. So, once AV node receive the electrical signal, the AV node delay the signal before actually depolarizing, and once it depolarize, it also creates its own action potential that then moves via specialized cardiac fiber called the bundle of His, and this bundle of His are found within the walls that separates the right ventricular from the left ventricular. So, this is all about the electrical generation of the heart. In the next session, we will discuss in detail the electrical cycle, that is the electrocardiogram, and how this electrocardiogram is generated and collected. Till then, have a nice day. Thank you.